community station. This is Bobo FM. The views and opinions expressed by the following program and its participants are solely their own opinions and do not represent the opinions of DMS Broadcasting and have no affiliation to the BBC.
At the Health Services Authority, we want to keep you informed about the latest developments that impact your health because your health matters to us. Join us each Friday and Saturday from 1 to 2 p.m. as we cover health news, offer advice, and answer your questions on Healthcare Today with HSA.
When you have a sports or fitness-related injury, trust the expertise of the HSA Sports and Exercise Medicine Clinic to get you back in the game. Our internationally trained and certified physicians specialize in sports traumatology, sports medicine, pain management, and orthopedic surgery. For treatment of common injuries such as tendonitis, arthritis, tennis elbow, rotator cuff, or knee tears, schedule a consultation with the Sports and Exercise Medicine Clinic at Smith Road Medical Center by calling 949-8600 or visit hsa.ky for more information.
All right, welcome back to a next show, proudly sponsored and provided by HSA. My name is Dane, and it's a pleasure to be here each weekday on this platform, Bobo. And we have the pleasure of interviewing so many different doctors, nurses, admin staff, maybe even the CEO of the company, and maybe a government official. It's all brought to you by HSA, and we always get to meet the remarkable superheroes behind this healthcare powerhouse. So we're going to start off by, of course, having each of the ladies in the studio introduce themselves this morning. And I don't think there's an order I can start. I think I'll just start with anybody that feels, hey, I'm a talker, so I'm going to go first. So the talker should always go first because they set that standard for everybody else and make them feel not so nervous.
Well, I don't quite agree that I'm the talker, but I've been volunteered to go first, and so therefore I will. Good morning, everyone. I am Therese Burrell-Prehay. I work as the Health Promotion Officer in the Public Health Department. I've served in this capacity for the past 19 years, and it's something that I absolutely enjoy doing. My primary responsibility is for health education and promotion, engaging communities in being proactive about taking accountability for their health and guiding them through the process of getting there. Thank you.
19 years.
Yes.
Oh, my goodness. Did you always start this? Was this always your role?
This has always been my role, but it's a multifaceted role.
Yeah, I can see that. Because you decided that, no, I'm just going to stay here. This is like my job.
It's second nature to me, public health.
You know what? And you can appreciate me saying this. People like you inspire me, but also at the same time, I despise people like you because I'm like, you're just too excited about your job.
I am indeed, and you can tell, right?
But it's more I admire you. That's the part. I need to find that passion that you have, which I do in radio. But there's other things I do on the side that I'm like, I'm not that passionate. I need to find that passion that she has.
Right. And in public health, if I should just add as well,
please.
That in public health, you have to be really passionate about what you do. It's a service that you don't get instant gratification from. However, the work that you put in today, you will see in years down the road. Yeah. And that's really satisfying for the persons who are really involved in public health. So all of us here are very passionate about the work we do.
You should be an advocate and a public speaker for HSA because you sell the company so well. You do a really good job at that. So you should go around inspiring, maybe even do a TED Talk to people that work in the medical field because that is something that's missing. I think a lot of people are, they want to get into medicine. They want to be a part of the healthcare industry, but they've lost their passion. So maybe you can be someone to ignite it. I don't know. Maybe it's the Holy Spirit telling me this. And it's like literally
I'll
laying on your chest.
consider it and take you on. Thank you so much for the compliment.
Lay on your chest. But thank you so much. Is there a part of your job, and I don't like to talk negative, but is there a part of your job, we're going to say that you hate, but it's probably a little bit more tedious, that you say to yourself, I wish I didn't have to do this part?
Because my role, I'm passionate about everything that I do, but because my role is so multifaceted, and I'm just one person who is responsible for the preventative health care in government for 83,000 people.
Wow.
So you can imagine I wouldn't say it's burdensome, but sometimes you don't actually get to focus on one particular area in the way you would like to because you are, in all different directions.
Yeah.
But you try to make the most of it. Again, it's about where your passion lies. And I have a passion for education because I am a teacher.
Okay. That's where it comes from then. See, so I was reading right.
Yes.
It was good. So I think my personal opinion, I think you have a bucket list. You should add that, like a TED Talk.
I'll definitely
I think you
consider
should.
it. Thank you.
For sure. And we're going to move along the table and have everybody else introduce themselves. We have 3 ladies here, by the way.
Good morning. My name is Joanna Rose-Wright. I have been in nursing for over 30 years, and I've worked at the Health Services Authority for 19 years also.
Wow.
I have worked as school health coordinator with responsibilities for health services in the schools, and then I became the nurse manager for primary healthcare services. I'm currently the senior nursing officer for primary healthcare and public health, which also includes health services in the prison. I love community health. It is a different feeling caring for persons in their own setting. Yeah. It is different than seeing persons well dressed up coming to the hospital, but when you go to persons' homes or when you see them in the community, you're seeing another person.
Yeah.
And I love that because persons trust you more because you get to see them in their vulnerable state.
You're entering their home, their safe space.
Yes.
So that's important. Yeah. 19 years, and a senior nurse. You've been doing this for, is it always just been nursing that you've been doing for 19 years?
Always nursing.
Always nursing.
And primary health care, community health.
Someone once asked me, what do you appreciate about the nurses, right? Because obviously the first thing we want to do when we feel sick and we feel out of it and we just want to see a doctor, it's always the doctor. You think about the doctor. It's no different than when you're flying in an aircraft, you're concerned, will the pilot get me there? Right. But I always, it's always that number one concern. Well, the pilot's the important one. He's walking with a necktie and everything. And, but as I come closer to an age of wisdom, I tend to find that it's you guys that kind of set the patient up for the doctor in the sense of like, that's why they're comfortable. Because without you, that comfort, like usually when I see my doctor, they're like, oh, you're okay. You said you're nervous with doctors.
Yes.
But you're more than fine. I said, you don't know what the nurse just said to me.
Yes.
Right.
It is that touch.
Yes.
And it's not a literal touch, figuratively speaking. It is that touch you get from a nurse.
Yeah.
It is like, I think patients or clients feel like we are on the same level and I can be more open, So it is like a cushion before going to see the other professional.
Absolutely.
So I think that's one of our things. We serve as a cushion for the patients.
I love it. That's a good one. That's a good one. And for those that are sitting in their vehicles right now saying, that's not a field I want to get involved with because you live in this economy, you're saying to yourself, it doesn't pay enough. I've traveled to Florida and all 3 of my brothers are married to a nurse. Oh. And they are the breadwinners. And my brothers work in finance, and they're the breadwinners. Wow. Apparently, I don't know what's going on in Florida, but the nurses are paid very well. And I've heard similar things here on the island, too. So that's just a perception.
Profession.
Yeah, that's a perception. I don't think it's right. So I think you should check it out, especially if you have one of those hearts that you love to serve people. It may be a field in the healthcare that you may be looking forward to do. You guys love serving people.
Yes.
That's one thing I can identify as. And you can identify yourself as someone that loves to serve?
We love to serve.
Yeah.
There is so much gratification from just seeing a patient walking away from you looking satisfied, saying thanks. That does something for you. And you get up the next day and feel like doing the same thing.
Yeah. And nurses make really good friends because you're not looking for anything back in return.
No.
Because you do what you do because you're passionate about it.
Yes.
You don't care if anybody's going to award you at the end of the day. So they really make good friends.
Yes.
That's something that somebody said to me once. And it's true. You can keep a nurse as a friend. Yes. We have one more guest to introduce. Hello. Good morning.
Good morning. My name is Angela Graham, and I'm a public health nurse. I've been working at the HSA for the past 17 years. 10 of those years have been as the person in charge of the vaccination program.
Oh, wow.
And that is where my passion really lies. We all know that in terms of preventing diseases, vaccination is a gold standard.
Yeah.
And as the person responsible for that program, we do all we can to push vaccination and to ensure that the island of Cayman the Cayman Islands are protected against these vaccine preventable diseases.
Absolutely. I want to always ask you this question. What is one of the misinformation on vaccine? There's so much going out there. This is, I can talk about Bill Gates, I can talk about getting rid of human beings and population control, so many different things. But what's the number one misinformation you've heard?
Okay. Well, we had a lot of negative information out there about vaccinations from years ago. However, since COVID, it has gotten really, really bad. I don't know what it is about this the COVID pandemic that has triggered these misconceptions, but we have found that in vaccination circles, we always talk about pre-pandemic and post-pandemic immunization coverage. So you'll find that during the pandemic and immediately after, vaccination coverage worldwide plummeted. And we are doing everything we can now to get the rates back up to pre-pandemic levels. One of them, I don't like to spread propaganda, so I will not get into some of the things that I've heard. But one thing we know is that one of the vaccines that we have the most misconceptions of out there is measles.
Yeah.
Hence, we're having measles outbreaks all around the world.
Yeah.
And that is one of the things we'll talk about today.
Absolutely. Yeah, that's going to be a big conversation along with a healthcare awareness day, which we're going to talk about very soon. But I think to answer your question, I think during the pandemic, I think what really happened is that people were just in fear. Like it was new. It never did anything to me until I realized I was stuck in the house for 4 months. And that's when I realized, something is off. Something is not right. And then this may be an ignorant statement, but I still felt like the numbers that we were hearing about with people passing away was not true. Like I kind of felt it was an illusion. We were being told this to stay inside. And you get to talk to your family overseas and they're driving past and seeing dead bodies on the side of the road, and reality kicks in and you're like, nope, this is scary. So when you obviously right after we were talking about vaccines, and then people were like, I don't trust that because I could be one of those dead bodies on the side of the road.
Right.
So yeah.
And I used to have my doubts as well until one of my colleagues who is a nurse, she lost her mother, she lost 2 brothers and a sister from the pandemic.
Wow.
And that really hit home to me. So I know it was real, And I proved at that point that vaccines really work.
Yeah. Yeah. So take your vaccine to all the kids out there and even adults, right? Which we're going to talk about very soon. Yes. But let's talk about a big conversation because on this day, we're going to be celebrating Healthcare Awareness Day. And tell us why this was created, by the way. It's a big one.
So, Primary Health Care Day. As you know, the public health team and the public health department, we engage with the public. We do island-wide health screening at supermarkets, at workplaces. And so we interact widely with the public. And in some of our interactions, we realize that a lot of persons are not aware of a lot of services that are available to them. So Primary Health Care Awareness Day was born out of this knowledge that we have, realizing that persons are not aware of the services that are available to them. So we decided to, it would be a good thing to have an awareness, and word awareness is important in that phrase. To create an awareness so that persons can realize the services that are available at the Health Services Authority, and so that they can make more informed decisions regarding their health. We're looking forward to this. We believe that persons' well-being is going to be changed. Persons' outlook on even doing screenings will be changed if they attend this day, Primary Health Care Day, and just even use even a small amount of the information that they'll get. We believe that it can impact them for a lifetime.
What's like one of the biggest objectives that you hope to get from this?
So one of the, two of the focuses of primary health care is availability and accessibility. And so we aim to increase awareness, to encourage preventative care, and provide the community with free health screenings, educational workshops, interactive wellness activities. We are hoping that persons will realize all the services are available and where they are.
Yeah.
Some of them are right close to them in the community, in the districts. So one of the things that we'd love for them to walk away with is, I know these services are available at Health Services Authority, and I know where
Yeah.
and how to access these services.
Because we had, before you guys, I think it was last week, we had a doctor in here that I didn't know that this area was in the hospital. I'm sorry, this practice. And it was about your breathing, basically. I don't know what that specialty would be
Pulmonary,
called. Yes. And I didn't know this exists. Like it was even a program that walks you through it. There's things, the signs that you need to look out for, that they're pretty much your advocate. Like not for a couple of days, but a couple of weeks. And I've even heard of some of the patients fell in love with that program so much that they didn't want to leave. So there's so many different parts of the hospitals that we just don't know. In HSA, we always look at HSA, and this, I'm speaking for my Cayman people. Yeah, I just go there if I have an emergency. And that's it. There's no special. I have to go to a small medical center or this place or this to see someone, a specialist, when it's actually in our backyard. HSA has these specialties that you guys can take part in. All right, so that leads me to my next question. How does this event, how does it make it different than other healthcare events that takes place on the island?
So, Dane, that's a highly anticipated question.
Yeah.
I think for many of the health fairs, they focus on general health promotion. But for Primary Healthcare Awareness Day, we will specifically emphasize preventative care and early intervention by screenings that are structured, practical educational workshops, and practical demonstrations. What we hope to do is to bring together a team of highly skilled, highly professional, most dedicated health professionals who are in the business of delivering primary healthcare services. Additionally, we want to be able to use these healthcare professionals to provide the most accurate, up-to-date information for those attendees who will come in real time, because we will have actually a consultation room where attendees can come and they can ask questions of the practitioners that are there in terms of making lifestyle changes. So that's how we want to be able to stand out in comparison to other health fairs. I say that graciously, however, because many practitioners host health fairs, but this health fair we are proposing will be different in light of the things that I have shared with the listening public this morning.
Yeah, it's so good. I mean, I love that part where you can get to speak to a specialist just right there on the spot, and do you guys do examinations for certain things there or no?
Well, we won't be doing physical examinations there, but they will have an opportunity to engage their practitioner on certain questions that they may need to have answered. Now, normally you would wait on an opportunity when you have an appointment to see the doctor. Your general practitioners will be there on site to take care of some of those concerns, provide the guidance, and even follow up.
I love this. You know what? When I first started the radio station here as a job, I remember my team looking at me and they're saying, HSA does a segment every single week, right? And we would love for you to be a part of it, like hosting that part. And I was like, why? Like, I'm saying to myself, why does everybody not want to do this, right? Because they said there's doctors. They're going to come up with these big words, words you've never heard of in your life, and you're finally going to embarrass yourself as on your personality. And I went to my was a general manager recently, and I said, guys, thank you for giving me that spot. And it's like, why? Because I've always been that guy that regardless of what happens to me, I can feel a pain in my chest or my knees is feeling weird. I just always, I'm a doctor myself. I figure it out. I'm saying to myself, I get over it. I'll eat this. I'll talk to grandma about it and she will tell me some remedy I can use. But what this has been teaching me is just like, manning up, or I like to use this phrase to my kids, man down. Because men like to say man up. And man up actually means don't go and see a doctor.
Right.
Don't go and see a nurse.
Yeah.
But a true man is a man that mans down and said, I'm going to do this because I want to be around to see my grandkids, my kids, and so many other things. My life is not over yet, right? And all it takes is just to go and get checkup. And these, I don't know what it is with Caribbean men that we just don't like the doctors for some reason. That's a strong word to use, don't like, but we're scared.
Yes.
That's the proper word. right? So I want to kind of talk about that throughout the show. But we're going to take a quick commercial break, and we're going to come right back. This is all brought to you by HSA, and you're listening to Bobo.
The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6534 or call 244-2715. For more information about our pharmacy hours, visit hsa.ky.
All right, we are back. Welcome to Bobo. My name is Dane, and this show is all brought to you by HSA, where we engage on different medical topics. We speak to the superheroes behind the scenes of HSA, where they work in admin, they're nurses, they're promoters, they are managers, marketers, whatever they do in the industry of healthcare in HSA, we highlight them. And today we are talking about, there's going to be two subject lines that we're going to be discussing. But the first one is, of course, the one that we're going to be focusing on right now at this very moment. It's the Healthcare Awareness Day. If you missed the show, we were talking about the Awareness Day, why it was created, the objective, and what's the benefit, and obviously what makes it a little bit different than the other healthcare conference and events that take place here on the island. Now, I want to ask, this is a really big question for those that are listening right now, just join to be a part of the conversation. Who should attend and what should they expect from this event?
Okay, so everyone should attend Primary Healthcare Awareness Day on April 5 from 9 a.m. to 3:30 p.m. in the afternoon. Anyone who wants to take accountability for their health, whether it's children, adults, parents, guardians, the young at heart, the not so young at heart, persons who are employed, and even persons who are not currently employed but have an interest in understanding what their health status is. What we can expect: exciting and interactive sessions from dental health. Our dental health team will be there, and they will be teaching us practical demonstrations on how we can keep those smiles beautiful. So we'll have demonstrations on how to properly brush and floss our teeth. We will have a much needed service for the Cayman Islands, which is mindfulness and resiliency. Mental health is a issue of concern, especially for those persons aged 10 to 20 years old. And we've seen these cases in the healthcare industry, especially after the pandemic. I'm looking forward to any studies that can reveal or show us why it is that after the pandemic, so much younger persons are experiencing mental health concerns. So our team will be out there, and the resources that, as I said, they will bring is going to be focusing on mindfulness and resiliency. Also, for those persons who want to get active, we have a Zumba class that will be out there, and you can come and, dress relaxed in the event that you do want to participate in the Zumba exercises. And also we'll have some simple demonstrations on how you can do simple exercises at home without injuring yourself. So those are some of the things that we are expecting persons to enjoy. And I think this is an opportune time for me to just hand over to my colleague Joanna, who will further discuss on some of the screening activities that will take place on that day.
Love it.
Thank you, Therese. And I don't know if the public is feeling the excitement.
I am.
I'm sure that there are persons right now who are saying, what? I'm definitely going to be there. Yes. So along with some of the services that Therese, my colleague, spoke about, we're also going to be having our diabetic educator. So they will be looking at, educating, giving information on preventative methods to prevent complications for persons who are diabetic or even persons who are at risk. We also will be offering immunization. So we will be conducting immunization clinics for MMR, tetanus, that's measles, mumps, rubella, and with what is happening now with measles. And all of these will be free. So it will not cost, it is not free to, they say nothing is free, but it will not be costing the public.
That's good. That's free then.
So we will be offering tetanus vaccine, human papilloma virus, that's HPV vaccines, and as I said before, the measles vaccines, and also the flu vaccines. We also will have staff there from the women's health clinic, and they will be have on display the services that are offered at the Women's Health Clinic. We will have our STI HIV coordinator. We will be also doing free STI HIV testing. So we are asking persons to come and be a part of that. We will be explaining our home care services. The HSA has the best home care services on island, and we will be, explaining this. How can persons become a part of our services? What are some of the things that we offer to persons who are at home and they are not able to access the service at the hospital? So there are a lot of things we'll be doing. I know maybe I'm missing some, but if you just come on there, there will be something for everyone from 0 to 100 years old.
It sounds that way, man. It's
Yes,
all important
yes,
topics.
yes.
We're talking diabetes was mentioned, mental health was also one, women care, and so on and so on. There's a long list of different reasons why people would want to come out and explore what this event is going to be about. I've heard things that have penetrated me to say, like, I'm going to go. I have to go to be a part of this because it looks like it's a wonderful, wonderful initiative. And this has been going on for how long? How many years has it been going on?
Well, actually, Primary Healthcare Awareness Day is an inaugural event.
Yes.
And we're certainly hoping to make it a staple
Yes.
activity and offering to the public from the Public Health Department.
I love it. It's something that needs to stick around. It just
Yes,
it
We
feels
do
that
believe
way.
in that.
Yeah.
Yes.
So it's definitely, I feel like this is going to be popular amongst our audience, our people here that live here. Our population is growing too. So this is even more reason to
Yes.
have more and more events like this. All right. So let's talk about what impact do you hope this event will have on our community? I just mentioned that. What is one of the biggest impact you hope that it will have? I already think about some things in my head, but I want to go to the experts on this one.
So fundamentally, we hope that this event will be a call to action for everyone who attends. Who are really interested in prioritizing their health. We want to be able to bridge the gap between the public and access to the healthcare professionals. And also we want to, through the screenings, the workshops, the practical demonstrations, we want to achieve a couple of things. One of them would be to encourage early detection of any ill health. For even example, hypertension, they call it the silent killer.
Yeah.
A lot of times we're walking around with elevated blood pressures, and because it's asymptomatic, we're not having those symptoms, and you come to a health screening like this and you realize that those numbers are not normative. They're not what they should be. And so that's a wake-up call for them to take action.
Yeah.
And so mostly we're hoping also to promote a culture of preventative care rather than treatment-based care. So we want to be able to tap into any lifestyle disease that may be there, that may not be known, and you can empower yourselves with the information that you have and do something about it. Yes?
It's scary, man, because you just said it, the silent killer.
Yes.
Because I walk around every day thinking I'm perfect, I'm okay. There's nothing that's wrong. And then you guys come in and we're thinking twice now, like, do I need to go and see a doctor? Because even with just like, you see some friends that are like in really good health condition, like you're jealous of them, and then you hear the next day they didn't wake up. That is scary.
Yes.
So I think the important part is you got to stop looking for signs. You just got to show up. How regular would you say that someone should be getting their checkup done? And that's probably a question for the nurse. You're right.
Yes, so it depends on what screening, because there are different, for different screenings, it is required for you to do it at different times. So for every person should try to see their general practitioner at least twice per year. That is something that is encouraged.
Yeah.
So 6 months, we shouldn't have 6 months past and you're not sure what is happening to you, especially 1 full year. Some persons have not gone to see their primary healthcare physician for over a year, 2 years, 3 years. That should not be, at least twice for the year if you think that you're in good health. And then there are other screenings. We need to do our mammogram or pap smear, all of those. So all of these things, if persons come down to John Gray Gymnasium, they will be getting information on all of these as to when, because it also depends on your age. So when you should be doing this screening, at what age, and how often you should be doing this screening.
That was gonna be my next question. Like, is it an age thing? Like, for instance, if somebody in their 20s, should they be visiting the doctor twice a year, or should that be once a year? Because I always try to say, because it doesn't matter, or you should just period. It's one of those things. Like, you care about your car, care about yourself more.
It matters because some persons, a 20-year-old could be having health challenge, and another 20-year-old could be okay. And it's good that you ask that, because some persons believe that it's making an appointment to see their primary health care physician, it's only for persons who are over 40, going up to 60. Persons 30 and below, feel like, I am in good health. I don't need to see the doctor unless I am not feeling well. Then I'll go to accident and emergency or urgent care. And that's not true. We need to know what is happening, because we see what is on the outside. We can't see what is happening. So even persons who are in their 20s need to follow up, maybe their family would have established a primary health care physician, so that young person should continue that relationship and maintain that relationship, so that they can also know what is happening. They need to know what different things. So at 20, there are some screenings that you would not need to do unless you are experiencing ill health. But it is important to also continue to establish and maintain a relationship with your primary health care physician.
Yeah. And I say also, and the reason I had to ask that question is because even for youngsters, like kids in their teens, I realize that they're extremely competitive in this landscape, because people are becoming more and more competitive. They even have sports schools that are out there now. So the kids are extremely competitive. And I find that they're taking these substances that they're not supposed to be taking, and it's destroying them, like even creating kidney issues and so on and so on. I was shocked at this young basketball player I saw overseas, and I was just, I had to go and speak to him because my son also takes parts in sports heavily. And I just remember admiring this young guy, and I said, man, like, you're doing so good. And he was telling my son right in front of me, like, hey, Liam, you're doing good too, but you should take this substance that helps me in the gym, but also helps me to perform on the court. And I remember going, I'm a person that I got to read the fine print, right? So when I went to pick up this product, I asked the guy behind the counter, I said, hey, this is safe for my son to use? And he was like, he just gave me this look. He's like, I wouldn't advise him to do this. This is actually causing kids to have hear loss. It actually states on the product, even though kids are buying it, do not use if you're below the age of 18. Consult a doctor first. And, my son got really upset with me, and he was like, but Dad, I don't have any kidney issues. And I said, you don't know your body. You don't know your body as well as you think you do.
That's true. And one of the things to bear in mind is that we have juvenile diabetes. We have children, we have teenagers who are diabetic. And so it is important to do these screenings. Sometimes when we are like at the supermarkets or doing wellness checks, you find that the younger persons will walk past because they don't think they need to check their blood pressure or to do their cholesterol or to do their blood glucose levels. Yeah. But it is very important.
Extremely important. And we learned this over COVID. The pandemic taught us that one of the biggest message was, don't go outside. I don't care if you're hearing that this affects older people. You may have an underlying issue you don't know about. So there were so many young people that were just breaking the rules. And then we heard of young people below 30 and 20s. They were dying because they had issues that they had no idea that this was happening. We're good at looking at I joke about this all the time. We're so good at looking at the check engine sign in our car, but we don't check the check engine sign on us. Yeah. Like, we care about our vehicles, our houses, and our landscape more than we care about us. That is crazy. So I answered the question here, I think, but what is the long-term goal for this event? What do you guys hope to achieve here?
Okay, so our long-term goal, as I mentioned before, this is going to be an inaugural event, but we hope to be able to host this event in many years to come. Joanna would have mentioned a number, and myself would have mentioned a number of the services that are offered through primary health care services. There are about 20 of them, but we will have on that day at least half of them, 10 of them. Yeah. So one of the things that we would like to do in the years to come is to include sessions for more of these services to be highlighted. Yeah. And of course, very important to continue to develop external partnerships, because that's how we'll be able to maintain our longevity. So with other healthcare professionals outside of HSA, which we continue to work with them closely, as well as schools and workplaces. We want to continue to engage them so that we can make year 2 through to 100 as exciting and as useful and beneficial as it can be if you want to prioritize your health.
I love it, man. I love it. Okay, so why is primary health care so important in the disease prevention and overall well-being?
Well, as it says, primary. Primary and preventative we use them interchangeable. So primary healthcare will allow for early detection and early treatment. And that's one of the messages that we'd want persons to get. Early detection leads to early treatment, and it leads to longer life. So it will allow us to, even persons already who are diagnosed with maybe, say, a non-communicable disease, a chronic disease, it also mitigates complications. So when you know what to do, you know the importance of taking your medication, you know the importance of practicing this lifestyle behavior, it mitigates the complications from the disease that you might be having at that time. Also, when we look at the increase in the amount of persons who are diagnosed with non-communicable diseases, chronic diseases, diabetes, hypertension, heart disease, the burden on the family, the burden on the individual, the burden on the country, the government. If persons can adopt even to, positive lifestyle behavior, this will be reduced drastic, and that money that is used to take care of healthcare, it could be diverted into something else.
Absolutely.
So that's one of the main reasons, or those are the main reasons we think primary health care is really important. Early detection, early treatment, less complication.
Big topic now in healthcare, because all the debates with the government candidates have been talking about healthcare and how important it is. I'm just trying to find a better structure around it. We do have, I have to admit this though, state-of-the-art medical facilities here, and it's way more structured than it is anywhere else in the world. So we have to be very grateful for that. Obviously, there's things that can be fixed, but it's not as bad as we experience around the world, right? This one is a big one for me. I will be stopping by and getting a screening done. I've been sold by the event. But I want to know what everybody else is sitting in the car saying. Man, how long is the screening going to take? And is there initiative? I would be sitting down at home nervous if the doctor's going to get back to me with something bad. But yeah, how long will this initiative take for us to get back results?
So what the things that we'll be doing there will not be, whatever we do there, you will know right there. Okay. So we'll be doing like blood cholesterol, blood glucose, all the things that we do there, you will know the results there. And also, of course, we will be advising you on how to do your other screenings, how to get your other screenings done. And if you are having challenges in getting an appointment, we can also take your name and other details, and we can assist. So we can make phone calls after to assist you in getting an appointment for that service that you require. There are times when we do screenings and persons will have results that way out of the norm. Now, we are putting structure in place to ensure that these persons are followed up. So when we do screenings and someone say has a very high blood pressure, it depends. Some of the times we would say make an appointment with your primary healthcare physician. And some of the times we have to take that person to accident and emergency right away, or send them with a family member. So that's one of the things that we'll continue to do. Now, one of the things that will change, though, instead of saying to persons, you need to make an appointment to see your primary health care physician based on these results, we will be taking those persons' details. So if you come to that screening and say your blood glucose we think that it should not be at that level, but you don't need to see the doctor right away. We will take your name, your telephone number. We will make an appointment and contact you with that appointment. We will also be following up to ensure that you keep your appointment. So those are some of the initiatives to follow up with persons after the screening and to ensure that persons are receiving the services that is required.
I love it, man. This has been a great conversation. We're gonna wrap up this segment, of course, on Primary Healthcare Awareness Day. But my last question is basically: is there any information that they can get by going to a social media or email address or a website that our listeners may be listening and saying, "I want more information on this. I'm gonna put this down in my calendar." But is there a place I can go to share with more of my folks and friends?
Sure. For anyone who needs more information, they can access the HSA website, www.hsa.ky, for all the information that they would seek more information on concerning Primary Healthcare Awareness Day. Or you can call the Public Health Department on 244-2889.
Love it. We'll be right back. We're going to be talking about a next important topic. So don't even think about touching that dial. We are Bobo.
When you have a sports or fitness-related injury, trust the expertise of the HSA's Sports and Exercise Medicine Clinic to get you back in the game. Our internationally trained and certified physicians specialize in sports traumatology, sports medicine, pain management, and orthopedic surgery. For treatment of common injuries such as tendonitis, arthritis, tennis elbow, rotator cuff, or knee tears, schedule a consultation with the Sports and Exercise Medicine Clinic at Smith Road Medical Center by calling 949-8600 or visit hsa.ky for more information.
All right, we are back on Bobo. This show is sponsored by HSA, where we get to meet the superheroes behind the background, doctors, nurses, admin staff, and so on. It's such a big department, such a big entity. We just have them usually join us each week to talk about their specialty, maybe a different, an event that may be coming up. Similar to what we did just a few minutes ago, where we talked about the Healthcare Awareness Day. Right now, we're going to be jumping into a topic I know very little about, but I'm pretty sure this young lady that's about to hit the airwaves is going to let us know a lot more about measles. And why is this considered such a serious illness? We're going to have you introduce yourself once again to the listening public, and we'll just jump right into it.
Okay, thank you. I'm Angela Graham, and I'm a public health nurse. Measles is a very topical is a very topical thing these days because of what is going on in the U.S.
Yeah.
I'm sure all of us have been hearing a lot about the cases that are there, and we just want to say a little bit about it today. Now, measles is a highly infectious illness caused by a virus, and this virus lives in the mucus of the nose and throat of persons who are infected. It is spread through physical contact. If the infected person coughs or sneezes. And also, there can be droplet infection in that the mucus from the cough and the sneeze and the talk can land on surfaces like door handles,
Wow.
tabletops, and so on. So, of course, persons will touch. And that, of course, it is also airborne. So, persons who come in contact with someone with measles can become infected. Now, the reason why it is such a serious illness is because it's very virulent. It's highly infectious.
Yeah.
So if for example, if somebody has polio and they go in a room with persons and you have persons in the room who are not vaccinated, 6 of those persons might come down with polio. If someone with measles go in a room of unvaccinated persons, they have the potential to infect like 12 to 18 persons. So it is a highly infectious disease. It's also serious in that it can cause complications. Now, when we hear about measles, we just think about a fever and a rash, and then that's it. However, measles can result in serious complications, even death. Complications like pneumonia, seizures, ear infections, eye infections that can lead to blindness, inflammation of the brain. In pregnant women, it can result in premature birth. It can result in premature birth and low birth weight babies. And the complications of measles affect mainly children under age 5 and adults over age 30. They're more likely in children who are malnourished. So we might say in Cayman, that's not such a big deal here. But remember that measles, there are persons who are very susceptible to getting measles, like persons who have immune system problems, persons who are immunocompromised. So you can have persons who are suffering from cancer, persons with autoimmune diseases. We can have persons who cannot get the vaccine, like children under age 1 those persons are vulnerable as well, and also are pregnant women. So there are persons in the society who are at risk for measles who cannot get the vaccine. And so this is a serious illness because we don't want them to come in contact with this virus.
Yeah, and just a lot of reports have been identified now with, we call it next door, our family, Miami. There's a lot of cases confirmed in the U.S., including Miami. What is the risk of this actually spreading here in the Cayman Islands?
So that's true. As of this week, March 13, there's a total of 301 confirmed cases in the U.S., 15 states in the U.S. And also we have over 220 cases in Canada. So the risk of spreading to our community is high, mainly because the Cayman Islands one of our industries is tourism, and so we have flights. We have flights from Miami. We have flights from a lot of these jurisdictions where we have measles now. So we are at risk of somebody just coming on the flight with measles, and you just need one case, as Angela has just explained, that it is highly contagious.
Wow.
So it is one of the things that we have to look out for, because if we have 15 states, and we have flights directly from New York, we have flights directly from Miami, we are at risk. And also we have children under 1 year old who have not been immunized because they would not be at the age to be immunized with measles. So those children are vulnerable. And if you travel with those children, they are at risk too. We have our vulnerable, also our pregnant mothers, as Angela said. We have persons, as she said, who are immunocompromised, who cannot get this vaccine.
Yeah.
So the risk is very high.
Yeah, and I think a lot of people would hear this topic and just not obviously pay a lot of attention. And like what you said, it's one of those things that just goes over a lot of people's head. And this is a very serious one. And I want to know for the parents. I want to talk to a lot of the parents right now that has your kids at school, because Miami is one of our direct terminals, right? So we do have a lot of travel constantly. I think it's 2 times a day now. It's back up to 2 times a day. How effective is the MMR vaccine against preventing measles? And this is an important one. At what age should kids be taking that vaccine?
Okay, so the MMR vaccine is highly effective in preventing measles. Here in Cayman, our immunization schedule for childhood immunization schedule has the first dose of measles being administered at 15 months. However, it is safe to give it from anywhere between 12 and 15 months of age, and the second dose at 18 months. Now, this vaccine has been around since 1963 and has averted close to 60 million deaths.
Wow.
And this is documented evidence, because prior to the measles vaccine, like in the year 2000, there were like 60 million cases of measles, and which resulted in many deaths. In 2023, the WHO estimated that there were only 107,000 cases of measles, 107,000 deaths from measles. And that's a huge difference between 60 million and 107,000. And that has been attributed to the introduction of the measles vaccine. Yeah. And one of the, we know that measles, the vaccine is effective in that one dose of measles, one dose of the vaccine is like 97% effective.
Wow.
When someone gets 2 doses of the vaccine, then that goes up to close to 100%. So no vaccine is 100% effective, but if you're going to get over 90% from one dose and close to 100% from dose 2, that makes it a very effective vaccine.
And with these cases that are popping up right now, is the perfect time to take these vaccines, right?
Yes, and most of the persons who have been confirmed, they are unvaccinated or partial vaccinated.
Wow.
Yes.
Not good. Not good at all. Is there a place, because we're getting ready to wrap up now, but is there a place that you can check, any individual that can check their kids' records and themselves also if they fall into these age gaps? Is there one area they can go to check their records just to make sure they're up to date?
Okay, so the public health clinic in Georgetown is the main place where persons can go to have their records checked. However, we do have clinics elsewhere. We have a very effective clinic in West Bay. We have one in Boddington, and we also have a clinic in the BRAC where persons can go and get their immunization records checked. And you may not get all the answers you need the same day you go, but we can always, when you go, whoever you speak with will take your name and number, and if we can't get the information right away, we'll get back to you.
I love it, man. This has been a conversation that we've been having around measles, and also we spoke about the healthcare awareness day that's going to be coming up. Ending the show on a very personal note, but I think it's important for our listeners to hear this note, is I remember when, this has been 18 years now, 18 or 15 years ago, I got a call from a family member of mine to say that, our little cousin got measles. And he was rushed to Miami on the air ambulance. It was really bad. But when I first heard it, uneducated on this word, on this disease, what it caused, didn't know anything about it. So to me, it was just kind of like, I will see my little cousin soon. Like, we're going to see him eventually, right? And he was in Miami, and I will never forget it. Still hard to talk about today. But unfortunately, he passed away. Wow. And it was a sad moment for all of us. And when we heard that, I think that's when we kind of look at this word now like, wow, this is not this is not something that you want to take lightly, especially if you have kids. Don't be left with saying, I wish I did.
Yes.
I wish I did, right? So please take this topic. But above all, these ladies have discussed some wonderful initiatives and wonderful things that are coming up. But we also touched on something that is also very important, and it's probably not a popular topic. But I would urge you, if it's even as early as this week, check your records and go and get your child vaccinated. It's very important. You won't regret it, right? Anything else that you guys would like to add before we wrap up?
Yes, one other thing. If, God forbid, we have a case of measles in Cayman, and you suspect that your child may have measles, we're asking you, please do not just rush the child to the hospital or to the doctor's office.
Good point.
Remember that measles is highly contagious. So if you suspect that you or your child has measles, pick up the phone, call your pediatrician, call someone at HSA, call the hospital, call someone else to help and get the message out there. And then we will direct you as to what to do, the steps to take. Because we wouldn't want you coming into a room now where you have vulnerable persons to infect those persons. So we would take you through the steps. We would do the lab works and all that, but we will guide you. And public health will take the initiative in that regard.
Love it. Thank you so much for mentioning that point. It's a great point to mention. Thank you so much for being a part of the show today. Don't forget, it's all brought to you by HSA. Each and every week, we have a special segment that we break down a different department, maybe a conference that's coming up or initiative that HSA will be doing. So we just want to thank you for being a part of this hour with us. Have a good day.